Good morning, everyone. That's good morning if you're in Australia, and good evening or good afternoon in whatever time you're in. My name is Stephen McPhail, and welcome to Prep Hour with Steve, number 2. And today we're going to focus on some of the common errors to avoid with articles. So we'll see who's coming online now. And while I'm waiting for people to arrive and put in comments, I'll bring up our screen, the document we're going to work with today. So I've just disappeared to the corner of your screen, and today we are going to work with articles. Now, before I begin, I'll just make sure that everyone is there. And if you're watching this now, just give me a thumbs up or say hi. Just type your comments into the screen so I can see who's here. I can see lots of names now. That's wonderful. Hello to Teja, Sandy is here. Hello, Mohammed. Great to see people here. And give me plenty of encouragement if you like what we're doing. We like to see those thumbs up and hearts come up the screen. All right, let's get started. So the focus today is articles, one of the most difficult areas of writing because there are so many rules and many things to be aware of. Yet correct article use is very important, because if we make errors with our article use, then it can impact on the communication we're trying to make. So a good understanding will really help you write at a higher standard. So it's a nice little diagram we've set up there. So we've got an image of a nurse here, a nurse. So we put an article because nurse is a countable noun. Perhaps a doctor is performing an operation. So we use the indefinite article "an" before the word operation. And then we have a body part, an organ. So for body parts, we use the definite article "the." And that's just the beginning. Let's dig a little deeper. So on this page, we will start to categorize some of the different uses. And I'm going to use my little pointer here. So in order to decide which article to use, we've got to ask some questions. So which questions will you ask? Well, is the noun countable or uncountable? That's always your first question. Second question, does the noun start with a vowel or a consonant? That will help you decide whether to use "a" or "an." Are you providing information for the first time? In other words, a non-specific noun. Has the information been mentioned before? In which case it would be something specific. So non-specific, we're normally going to use an indefinite article like "a" or "an" if it's a countable noun. But for a specific article, we're going to use a definite article, whether it's countable or uncountable. Now I'll be going through all these things in detail. So don't worry if you're a little confused in the beginning. All will become clear. Are you using the singular or plural form? That's another thing to consider. Singular countable nouns require an article, plural forms don't. So lots of things that you need to consider when you're looking at your articles. Now let's look at some categories. So we said before we've got to decide if it's countable or uncountable. So let's look at the categories. So for countable nouns, example, professions. Let's look at some medical professions. nurse, dentist, doctor, veterinarian, and so on, any profession will always be a countable noun. So you'll need to put an article before that noun. If you don't, the reader's going to be a little bit confused. You know, native speakers, we identify this and we expect the article. So when it's not there, it sort of can temporarily confuse us a little. Body parts. As health professionals, you have to talk about body parts. Body parts require an article. For example, a joint or a tooth, a toe, a finger, these are all body parts. If there's only one of them, for example, stomach, we're going to say the stomach, the nose, the ears, and so on. We'll need to use a definite article. Some injuries require an article because they're countable nouns. A bruise, a cut, a limp, all are countable. Other times you've got nouns which describe someone. Maybe you're a smoker, maybe they are a drinker, in this case, a moderate drinker. We have to watch out for symptoms. Symptoms are often countable. A cough, a runny nose, a headache. These are all countable. So if used in the singular form, require an article. And then the tests that you conduct in your day-to-day work, a blood test, an ultrasound, an MRI, these are all countable. So your job is to build your awareness of which nouns are countable and which are not. If we look at uncountables, we can also categorize these. I'll just make my screen slightly bigger. For example, fluids. Fluids are uncountable. Blood. We can't count blood. We can't count water. And we can't count saliva. So in these cases, we won't use an article. Gases, oxygen, nitrogen and smoke. These are things which can't be counted. So we're not going to use an article. Certain particles, things which are really small, dust, dirt, sand. We can't say the patient had a sand in his wound. He had sand in his wound. Names of diseases. Cancer. We don't say he has a cancer or the cancer. It's an uncountable noun. Diabetes, pneumonia, influenza, all of these diseases or medical conditions don't require an article. They're uncountable. And then we get things which are abstract in nature. We can't physically touch them. Things like education. We don't say an education, we say education. Progress, the patient's progress, that's uncountable. Health is uncountable and information is uncountable. So things which are abstract, that you can't physically touch, are often uncountable. And then certain activities which we often use gerunds to describe, walking, sleeping, and so on. These are also uncountable. So rule number one, identify whether your noun is countable or uncountable. Now let's look at some examples. And this is a chance where you're going to be able to input, and I'm going to look at some of the text messages that you send through. So the rule, look at this pattern, everyone. First, we identify that it's a noun. Then we go, okay, it's a countable noun. I know it's countable. And then you've got to decide, is it non-specific? In other words, have I mentioned it before or not? And then if it matches all of these things, then you go, okay, I'm going to use a or an, depending on whether it starts with a vowel or a consonant. So, one more time for the rule. When a countable is mentioned for the first time, the indefinite article a or an is required. This signifies to the reason mentioned before and hence is non-specific. So I've got some sentences on the left-hand side of your screen there, which are clearly wrong. And I want you to help me correct these. So I'll read the incorrect one. And if the audience would like to type in what you think is correct, and I'll respond to that. So the first one, I'll read it out. I'm writing to refer Max, 15-year-old boy who was admitted to hospital on this date. All right, there's your first wrong sentence. So I'm going to look at your comments here. Hello to Rhubarb and some of our past students. When you're ready, guys, just type in your comment. Michael, well done, Michael. A 15-year-old, that's correct. So I can type that in, everyone. I won't do the full sentence here. I'll begin it though. I am writing to refer Max, comma, a 15-year-old boy. What is the noun that's countable here? So we know we've got to put the article. Which is the noun that's countable? Which is the noun that's countable here? Eva, well done, Eva. Eva Tin, it's boy. That's right. So that's the one we're looking for there. Well done. All right. So that's our countable noun. What about the next one? Examination reveals this on her gum. Can you correct that one for me? I'll begin it while you're putting in your answer. Something is going to go here before the word abscess. What are we putting here? Well done, Alicia. It's got to be and, doesn't it? Because this is before a vowel. And abscess is a countable noun. Now, a lot of you might think, oh, abscess, is it countable? But you could have multiple abscesses in different locations. So it is one of those words in injury which is countable. So it does require an article. All right. Now I'm going to go through and do these, and to speed the process along, just look at the sentences as you go, and if you can spot the errors on your screen, type in where you think the article belongs, and I'll type it up correctly for you. So you can look ahead at all of these ones. Apart from bruises to her body, so we're using plural bruises, apart from bruises to her body, X-ray revealed that she has fracture in her right joint. So where's the error there? And the next one, patient has right tender elbow joint. There's a mistake there. Patient has allergy, something's missing. John had ache in his lower back, something not right there. The patient has family history of diabetes. So all of these have something wrong. All right, we've got the first one. Yes, reveals that she has a fracture. Now you can imagine your case notes on exam day will not have an article for that. It'll just say fracture, right ankle. So your job is definitely to put in the article before the word fracture. Okay, next one. The patient has a, that's correct, well done, a tender right elbow joint. So what's the noun, the countable noun? It's joint. It's got nothing to do with tender. And in this case, nothing to do with elbow, because that's just describing the particular joint. It's acting as an adjective. It's the word joint that tells us. And we have many joints, don't we? Lots of, look at all my finger joints. They're countable. A tender right elbow joint. Has anyone put an answer for allergy? I saw Manal put something, bruises. Manal, for the one bruises, because it's plural, I'll just go back, everyone. Look, Manal's mentioned something about bruises. But in this case, it's plural form. So because we've used plural with an S, so there's more than one bruise, we don't need an article. But bruise is a countable noun. But in this case, there's more than one bruise, so no article required. Plural forms of countable nouns don't require an article. Okay. And if it's an uncountable noun, there is no plural form. Okay. Next one, the patient. Someone's already corrected that one, I think. Yep. Patient has an allergy, because allergy is a countable noun. John had, what's the next one? John had an ache. So we can see allergy and ache, they're both beginning with vowels. So we're going to use the and, not up. And the last one, someone's already written that in, has a family history. What's the noun, everyone? For this one. It's not family. No, it's not family either. It's because that's two nouns together, family history. So when you have two nouns together, it's the second noun that's the main noun. So it's actually history. History can be countable. When I looked at the histories of the different patients that attended the clinic, I picked up a trend. So a word like history, which is often not used in plural form, can be. So family history. Okay, excellent, excellent. Give me a thumbs up if that's all clear, everyone. Now we'll continue. I'll just clear this page. Let's now go to uncountable nouns. If I can make it a tiny bit bigger for you guys. How's that, everyone? Is that helping? Try to get a good size here. Sandra says can't read the screen. It may be due to your internet speed, everyone. Maybe due to your internet speed. How's everyone else going? Sandra says it's probably your internet speed. How about the rest of the audience? Is your screen clear? That's clear. I think it's just this one's slow. Yes, just as Eva's given good advice, go to the setting, change your quality. It's probably related to your internet speed. Let me check. Eva, is it clear for you? Let me know in the audience if it's clear on your screen. Just depends on your internet speed. Jane's got a clear screen. Excellent, Jane. Thank you. Yeah, it can relate to internet speed. All right. So we're going to do uncountable nouns. So, and we're talking about ones which are non-specific. In other words, you've mentioned them, you are mentioning them for the very first time. You're introducing them. So when you're writing your referral letter and you're talking about an injury or an illness or something about your patient, you're mentioning it for the first time. If it's uncountable, it's a noun, it's uncountable, it's non-specific. In this case, we use a zero article. The zero article means there's no article. It's very important. So let's have a look. So here's two wrong examples. The patient has a cancer. The patient has the cancer. They're both wrong. I'll do the first one for you. We simply write the patient, has cancer. Simple, no article required. Mr. Jones had, now it's up to you to tell me what's wrong and tell me why. So, well done, Sandia, glad it's better for you. Now, you can make comments on any of these ones and I'll be checking your comments. I'll just read them out and then you tell me what's wrong and try to tell me why. What's the issue here? Mr. Jones had a surgery in 2017. I see that written a lot, but it's incorrect. I would appreciate if you can provide an education on lifestyle changes. The patient has moved to a rental accommodation. The patient has a pain in her left shoulder. Thank you for seeing Mr. and Mrs. Conway, who have presented to me for the fertility advice. Okay, so the second one, and add your comments, and I'll explain as we go. So we're going to say had surgery. Why? Because surgery, interestingly enough, is an uncountable noun. Operation is countable, but surgery is uncountable. But you might say to me, but in my hospital ward or in our busy day, we say we've got multiple surgeries today. So yes, in spoken English, and it may be used in that way, but even when we say surgeries, we're really saying that's a short form for surgical procedure. So we've dropped the word procedure, we've just called it surgeries. So you just have to remember surgery, we don't say he had an surgery or he had a surgery, he simply had surgery. You've just got to lock it into your memory. I would appreciate if you could provide an education. Don't provide, education is one of those abstracts we saw before, isn't it? So we just provide education. And you could say provide some education. That would be correct, but we don't really need to. We simply provide education. That's enough. The amount of education in a medical referral letter is not important. Patient has moved to a rental accommodation. That's an interesting one. Accommodation is an uncountable noun. So that means he's moved to, we're going to drop it. And you might say, but I want to use another, it's a type of accommodation. It's not a owned accommodation or it's not a new accommodation. It's a rental accommodation. So sometimes we use an article because we are referring to something specific, the specific type of accommodation. But in these cases, quite often there are two rules. There's countable, uncountable rule, and there's also a rule whether we've mentioned something before or whether it's specific or non-specific. Usually, the countable or uncountable rule is the strongest. It's there first. So that is the rule we apply. So he has recently moved to rental accommodation. So that's one of the things we face sometimes. There are two rules and they're conflicting with each other. Normally one rule, particularly the countable, uncountable rule, is stronger. So we apply that one. And that just comes through you looking at lots of examples and learning what feels comfortable. Okay, the patient has a pain in her left shoulder. So here we're going to say patient has pain. Now this will be a bit controversial. Is pain countable or uncountable? Sometimes we'll say patient has a slight pain. So pain is one of those ones where we can go two ways, and you'll probably see both written. For most Australians, we prefer not to use the article with pain. She simply has pain. It's more of an uncountable, because you can't say patient has 3 pains. So we use the uncountable. It is one of those words, though, where it's quite borderline, and you might see different versions in the written English world. But my advice is to use it without the article. Patient has pain in her left shoulder. And the last one, thank you for seeing Mr. and Mrs. Conway, who presented to me for, this person's wrote the fertility advice. They're trying to make it specific. But tell me, there's a reason why we have to say there's no article, it's a 0 article. And why are we doing it? Oops. Because advice is uncountable. That's the uncountable noun. And because you're mentioning it for the first time, we don't need to say the fertility advice. We're going to use the 0 article because we haven't mentioned it before. All right. Any questions so far? Give me a thumbs up if it's all good. And I'll move on to the next one. We've got more to do. So that's countable, uncountable nouns for non-specific situations. Now we're going to move to specific situations. Lots of thumbs up coming up. That's wonderful. So for specific cases, whether it's a countable or an uncountable noun, doesn't matter. If it's specific, we're going to use the definite article. For both countable and uncountable, we're going to use the. And it's very important to include this because it really does tell us that it's been mentioned before or it's something known to the reader. It applies to both singular and plural forms. And remember, as like the other articles, these are usually omitted in the case notes because case notes are in short form, don't need to, and they don't need to follow the standard grammatical rules. But for referral letters, you need to apply and adhere to the standard grammar rules. Okay, so we're looking at our case notes. Microgynon 30, and we've got a period of time where this pill or medication was taken. So wrong, she had been on microgynon for previous 5 years. One of the most common errors that I see. So I've underlined the noun in question. So we've got to say for the, oops, I think I gave it away. So this is something specific. It's a specific period of time, everyone. I'll type this one in. A lot of people leave this one out for the previous 5 years. So it's something specific. It's not the next 5 years. It's a specific time period. So years is in plural, but we definitely need that article. If you leave it out, it's definitely a bit confusing to the reader because we expect it. And then we got the same example on the next one. or let you do it. It's the same rule. It's a period of time. Smoker 12 years. We're going to use present perfect, which we covered in our last lesson if you've watched that video. So we're going to say he has been a smoker for the last 12 years. There we go. Pain, L ankle. The patient reported pain in, help me with this one, in what goes here? I think you know the answer. I'll read the others as well. Based on above information, I believe patient needs urgent admission to hospital. Thank you for seeing this patient who presented at my surgery regarding tooth 54, which has been temporarily filled by school dental service. Thank you, Sandia. There was a double error on one of these I'm going to put up. Just bear with me. Yes, thank you for observing that one. This had two errors, one of these ones. I'll just add it. Patient has been a smoker. I'll just handwrite it in for the last. Yes, has been a smoker. Well spotted. There was two errors there. All right, back to where we were. Patient reported pain in the left ankle. Now we could say her left ankle or his left ankle. So the pronoun his or her can also be used, or you can choose to use the definite article. They're both correct. So Rajesh pointed that out. Well done, Rajesh. Based on above information, based on what, everyone? It says above information. So that means we've mentioned it before, don't we? If we're saying based on above, something's above information, then it's been mentioned before. So we definitely need to say that based on the above information. Now we've got a tricky one. I'll type this one out. I believe the patient needs, so someone's wrote an urgent admission. Yes, it's possible, right? This is where English gets tricky. The question is admission a countable noun? Well, we can argue both ways. There were many admissions today, so it can be pluralized, so yes, countable, right? But on the other hand, this patient themselves can only really have one admission. So I would say here, patient needs urgent admission is one of those cases where both are acceptable. You may use the article and, because admission you may argue is countable, but on the other hand, some people say yes, but in this context it's not really countable, so we don't need it. So it's a case where both are correct. Now there's a lot of incidents like that, a lot of situations where both are correct. Just to make it harder for you guys. English is quite an abstract thing in itself, language. So when you're doing languages, there are always exceptions. That's just the fun. Next one. Thank you for seeing. Just repeat that one time. Thank you for seeing this patient who presented at my surgery regarding tooth 54, which has been temporarily filled by school dental service. And this is a good one for you dentists out there. By school dental Eva wants to say the tooth, and so does Sandia, yes, but I don't want to, and I'll tell you why. Here we've got a choice. We could say buy a school dental service, which means not one in particular, or you could use the school dental service, meaning the particular school that the child attended. So this is one where you actually have a choice. You can use indefinite if you think, yes, it's just a school service. It doesn't really matter which one, it just happened. But if you want to use the, then you're specifying that it was the school that that child attended. So you actually have a choice depending on the meaning that you want to convey. If you say a school dental service, it's just a random service. Service is countable. But if it's, you want to make it specific, the one that the school that the child attends, we can use definite article. So we have choices, everyone, choices. A couple of people said we should put regarding the tooth 54. Yes, because you are talking about a particular tooth, you might think so, but in this case, there's only one tooth 54. There aren't two 54s, there's only one of them. It's like I live in Australia. I don't live in the Australia. There's only one Australia. So I live in Australia, right? But if it was an island, I live on an island, there are many islands, right? So it depends. If there's only one of something, in this case 254, then we don't need an article. Think about maybe you live in the UAE. So we're not going to say, we're going to say I live in the UAE. Why? Well, there are United Arab Emirates. There are many Emirates. You live in the United States. There are many states. So with countries, if it's one of many, the Philippines, I live in the Philippines. Many something, many what? Many islands. So the rules appear in many different places and situations, and quite often there is a reason for that. Okay, let's continue. Blood tests, 3, 7, 18. So we've got some case notes here on the left-hand side. Blood test result negative. Initially, she came to me on 3, 7, 18 for the blood test. The results of a blood test were negative. Well, there's 2 mistakes there. Can you see them? And the next one, broke left arm following school playground accident. Thank you for seeing this patient who presented today with the broken arm following the accident at school playground. It had been 40 minutes since the accident. Type in what you think's wrong there. All the articles are wrong here. Now Sandy's writing while I'm waiting for those responses. Sandy's written my argument, the right ankle, though there is only one. No, good point that you've mentioned there, but there are 2 ankles, Sandia. There are 2 ankles. Just pause for a moment. Just checking, can everyone see the screen still? Just a moment, I'm just pausing everyone. Just refresh the top. Oh yeah. Just my screen went a bit funny there, guys. I'm back. Hope you can see everything. All good. We're doing this live, so we've got to do our tech work at the same time. These things always happen. I'm just catching up with my comments, everyone. Okay, the results. So people have put the answers, the results of the test, yes. So I'll cross these out. Who came to me for, so first time we mentioned something, shall I use a different color pen? So we're going to do this here. I'll correct these with a pen for a blood test because it's the first time. It's not specific to, it's just a blood test, a type of test. And the results of, and when we mention something for the second time, and I'm sure you guys know this, is a very important rule because it creates cohesion, everyone. The results of the blood test, which blood test? The one you mentioned before, were negative. So this sort of thing is vital to get right. You'd lose big marks if you got this wrong because it would definitely confuse the reader. Next one. Thank you for seeing this patient who presented today with the broken left arm. Now, again, I don't know if anyone wrote this one, but it's the same, and Sandy mentioned before, when we're going to say a broken left arm. Yes, it's a specific, it's the left one, but there are two arms. So a broken left arm. Following the accident. Well, it's the first time, isn't it? Someone's already written this, following an accident at, still missing an article. Well done. Sandy's got that one. At the school playground. It has been 40 minutes since. So we're going to say the school playground because it's a particular playground. It's the school one. And now we've mentioned accident before. So we're going to say since the accident. All right, so you can see, look at the potential. It's very tricky and you need to think about these things. And my advice, everyone, work at sentence level. When you finish writing your sentence, particularly in your skill building stage when you're practicing, double check your sentences. Probably on exam day, I would be saying to you, finish your paragraph when you're writing a paragraph, then go back and check and start applying these rules. Check your articles. Have you got them right? And if you don't check and you get them wrong, you're going to be penalized for that. So attention to detail is very, very important. It's the little things that often count. All right, and I can see Alicia's put in something there as well, who presented with a broken following an accident. Very good, Alicia, you're on to that. Great to see people doing well. Okay, let's move on. Here's an interesting one that you guys might like. Versus and. So now we're talking about which vowel, whether to use and for our vowels. So we said before, A, E, I, O, U, we use and. But if we begin with a consonant, like B, C, D, F, G, and so on, then we use a. Maybe you can think all the way back to when you first started learning English many, many years ago, and this was probably covered in your English classes a long time ago. And that rule is basic, but it's the exceptions that cause issues, and the exceptions are based on the phonetic sound of the word. So what we've got here, I've got a number 1 and 2. So I've put 2 sentences. So the job of the members here, you have to tell me which one is right. Is number 1 right or is number 2 right? That's what we have to do. So the first one, I'm writing to refer an 18-year-old student who, or I'm writing to refer an 18-year-old student who. So number 1 or number 2, which is correct? Just type in the number 1 or 2 for which one you think is correct. Amar's got it. Yep, we're getting lots of 2s. Excellent. It is number 2. It's not number 1. 1 is wrong. And why? Because phonetically, and 18, the word 18 begins with a vowel, E. So we need to use an. Okay, next one. Mary is an 83-year-old woman with a 3-year history of dementia. Mary is an 83-year-old woman with a 3-year history of dementia. Which one is right, 1 or 2? Someone said 1 is right, but no, 1 is wrong. Because 80, again, the same thing. It's an 80. It's the same rule. And 83 begins with a vowel. So both of these cases, we need to use an. Okay, next one. Daniel is a 17-year-old student. Daniel is an 17-year-old student. 1 or 2, which is correct? For number 3. I'm not sure if I saw some number 2s, but they might have been coming for the old one. Because of the word 17, he's a 17-year-old student. Could you get that one right? So it comes down to, even though we're writing it as numerals, we have to apply the phonetic rule. What about the next one? This will be tricky. John is an university student, or John is a university student. So we're starting with a vowel. University, right? So vowels say we use an. Consonants say we use a. But what about this case? A few people are saying 1. 1 is correct. No, 1 here is wrong. And the actual correct answer is a university student. Number 2. Why? Does anyone know why? I could answer it for you, but can anyone in the audience answer it? Why do we say a university student? What's the reason? What's the rule? Does anyone know? I'll be impressed if you can get this one. Yeah, Joseph said it. An university sounded wrong. It does sound wrong. It does sound wrong. But why does it sound wrong? It sounds weird. Exactly, Joseph. You know internally. And the reason is the pronunciation. We pronounce it university. University. So we pronounce it with a vowel. It's written, we pronounce it with a consonant, the Y consonant. But that's the sound, isn't it? So tricky. So Sandy said sound is you. Yeah, you as you're writing it, not exactly. Well done. So it's a Y sound. Y. Okay. What about this one? The next one. A urine test is required, or an urine test is required? I think we've got the same rule here, haven't we? We've got to put a Y here. So this is exactly the same. A urine test. Now, if I was French, they use the word urine. It would be a urine test, but in English it's urine. So it comes down to pronunciation, everyone. Please arrange an MRI test and an X-ray. Please arrange an MRI and an X-ray. 1 or 2 for the last one, everyone. Yes, a urine. Oh, we got that. Well done. Joseph is French. French. So Joseph, you have to, yes, you have to use your English pronunciation there. All right. And the last one, I can see people putting in the, I can see people putting in the correct answers there. That one is wrong. So it's phonetic again, everyone. An MRI. So we're actually saying here, and can you pick the sound? What's the sound before MRI and X-ray? What's the vowel sound that we're hearing? What's the vowel sound? Can anyone pick it? Well done, Mike. I recognize your name. It's an MRI, it's E. So it's phonetic. So now you know there are exceptions, everyone, based on the phonetic sound. All right, let's continue. Got a few things to do, so I do want to continue. All right, here we go. Now I'm going to go through these. This is the same. We'll go through these relatively quickly. These are special cases. So we've gone through all the rules, but there are so many cases, and I'll try to explain these quickly as we go. So we got three sentences. We got on the left, indefinite, in the middle, definite, and on the right-hand side, zero. I want you to tell me which one is right. So number one, indefinite, definite, or zero. Patient underwent a left knee operation. While you're thinking about that, I'll just do something here. Patient underwent a left knee operation. Patient underwent the left knee operation. Patient underwent left knee operation. Imagine we're mentioning it for the first time, the very first time. So we're going to use indefinite, definite, or zero. We're mentioning it for the first time. I'm going to use, I've got a few things going on here. I'm going to say, and Gupya's put the patient, it's number one, yes, first time, right? And a couple of people, you might be asking, well, do we need to put the patient? Well, you can put the patient. It's a tricky one. And I think some English teachers would like you to put the patient. But for me, I think medical professionals often use this like patient admitted. You know, I've seen a lot of referral letters where native speakers don't put the patient. They just say patient. Or baby presented with. They don't have to say the baby or a baby. So there's special use cases that sometimes defy the expected grammar rule, and it's just the it's the conventional use. So sometimes conventional use is different to the rule. So as I said before, it's tricky. But when in doubt, say the patient. So next one, Mary has been experiencing pain in the stomach. Well, we might do the rule out thing here, so we know these are wrong. A stomach. Well, no, we can't use a. Mary has been experiencing pain in the stomach. How does that sound? Or Mary has been experiencing pain in stomach. Well, it's a body part, everyone, so we need to put the definite article. I'll talk these through, and you just type in what you think's right. So that's correct. John has had a headache for the last 3 days. John has had headaches for the last 3 days. So we're using singular and plural. John has had the headache for the last 3 days. John has had headache for the last 3 days. Well, I would say here with these ones, I think he's had a headache for the last 3 is good. He's had headache, so they're both correct. John has had a headache for the last 3 days. Well, if it's a specific headache, it could also be correct, right? Something specific. If you're mentioning it for the second time. John has had headache for the last 3 days. No. That one I would not accept. That's okay. Next one. Margaret was diagnosed with a dementia in 2016. Margaret was diagnosed with the dementia in 2016. Margaret was diagnosed with the dementia. Oh, this one with dementia. Ooh, with a dementia, with the dementia, or with dementia. Indefinite, definite, or zero. I can see some zeros coming through here. So they're wrong because it's a medical condition, everyone. Simply dementia. Harry was advised to stop drinking. Harry was advised to stop the drinking. Harry was advised to stop drinking. Maybe you remember before where we saw the gerunds, the rule with gerunds. Gerunds don't normally have an article before them. Okay, let's do a couple more like this. The patient is complaining of discomfort during a passing of urine, during the passing of urine, discomfort during passing of urine. That's a hard one. Definite, indefinite, or zero. Well, I'll show you, and I know you're thinking about it. These two are wrong. We use here during the passing of urine. Now, this is a tricky one. What's the exception here? Well, often what we've got happening here, we're nominalizing the noun. So in a sense, when you nominalize something, you make it specific. So it's something specific during, not the drinking of urine, as if you were in the desert. It's the passing of urine. So when you nominalize the noun, and this is a noun, and this is a noun. So when there are two nouns here, it becomes something specific. There's a few exceptions with that rule, but that's just something to remember. It's a hard one, that one. The pharmacist advised to complete a whole course of medication. The pharmacist advised to complete the whole course, or the pharmacist advised to complete whole course. Well, I think you'll know some of these. Obviously, this one's wrong. So is it a whole course of medication or the whole course? Well, in some circumstances, we could say a whole course, but normally we're referring to something specific. So I think this one's preferable, to complete the whole course, not the half course. So it's a specific amount. And again, it's a nominalized form, course of medication. So I prefer that we use the here. Max had a similar complaint last week. Max had the similar complaint last week, or Max had similar complaint. Well, again, in this one, I'll show you. Complaint is countable to start with. You could have multiple complaints. But we can't say the similar because it's not the same. So if it's similar, it hasn't been mentioned before. This complaint hasn't happened before. It's similar. There has been a complaint, but not a similar one. So we're going to say ah. But the next one, everyone, Max had a same complaint, the same complaint, same complaint. In this case, the word same always uses the definite article, never indefinite. Because if it's the same, it's been mentioned before. It has to have been mentioned before. So we can dig deeper and apply the rules here. So similar and same have different grammar rules. You need to lock it in. Patient requires an ongoing care. Patient requires the ongoing care. Patient requires ongoing care. Now this one confuses a lot of people. So we could say he requires an ongoing care. It kind of sounds okay. It's a type of care, right? And maybe you're mentioning it for the first time. So is care uncountable or countable? Well, it's the two rule. Yes, you can say an ongoing care, put the article for a type of care, something, we're specifying, but care is uncountable. We can't say cares. So because care is uncountable, that is the stronger rule, and we're going to use the last one. Patient requires ongoing care. So I can see Sandy wants to put an ongoing care, but it's wrong, Sandia, and it's something you've got to remember. Just they require ongoing care. So you've got to change your habits and adapt to this style. It's a tricky one. It's a fine line. Dylan has experienced an acute pain in the groin for the past week. Same rule here. An acute pain. Which do we accept? Dylan has experienced the acute pain, so it's definitely not the middle one. Dylan has experienced acute pain. Now, for me, this is a personal preference. I prefer this. But if you put has experienced an acute pain, if I was your teacher, I wouldn't mark you wrong there. I would accept it because it's in use. I'm going to give this one 5 ticks Maybe I'll give this one 3 ticks, right? I prefer to use a 0, but you may find different opinions from different teachers as well, depending on what they're comfortable with. So again, it's English, it's abstract, there are variations, and it does depend on the context. So sometimes more than one answer is correct. All right, now, last activity of the day, and then we're going to end this one. So I'm going to do this last one really quick, and then we'll have a quick few questions. So the last thing, everyone. So we've got to, we just got to do a gap fill, everyone. So this is a letter. Let's put the article. I might go a little bit ahead of you just to see the pace. See how we go. I'm writing to refer Amina, who is presenting with signs and symptoms of meningococcal meningitis. She is something of family of 5. So what's our first article? She is she first child, our first child, the first child? She is, just type in when you think you know the answer. She is, thank you, the first child of what? Of family of 5. Of a family of 5, thank you. Which includes her parents and 2 younger siblings. They are immigrants from Somalia, though she and her father understand English. Initially, accompanied by her parents, she presented to me on the 9th, 10th, 18 with complaints of fever, runny nose, cough, and loss of appetite. She was febrile with something of 39.4. Yes, it's already going in with up temperature, it's countable, of 34. And next one's the same, isn't it? Up pulse rate, because rate is countable. 85 beats per minute. But there was no rash or neck stiffness. However, her condition continued to deteriorate over, we did this rule before, over the next 2 days, as they've mentioned fever before, and this is really tricky, as we mentioned fever in the beginning, so this is mentioning something for the second time. We've got to say as the fever, because it was mentioned before. Now you might say, I'll just draw attention because you might be confused here. Earlier I said like a runny nose, cough, these things are countable, right? But this is where English gets interesting. You could have complaints of fever. I just Jentums, right? They often drop that article. So it's optional, just complaints of fever, runny nose. So again, there are exceptions, but you could put the article, but only for the first symptom. As the fever could not be controlled by antipyretics, therefore blood and stool tests were ordered. So no article there because test is plural. Regrettably today, Amina became lethargic and listless. She vomited twice last night and had been experiencing severe headaches. Headaches is plural, no article. 0 article. On examination, she was severely febrile with a temperature. It's the same, isn't it? It's a new temperature. Alicia wants it's clear, but that will be coming clear in a moment. Or it might be at your end, with a temperature of 42, and we saw this before. It's a new one, so a pulse rate of 110 beats per minute. There was macular papular rash over, I'll type this in, the legs, and neck stiffness was present. You could also say her legs, because it's a female in this case. blood showed leukocytosis with, probably that should say blood test, but blood showed leukocytosis with what? With a shift to, I think the right answers are coming in, with a shift to the left. Well done, Manal. Well done, everyone. It's a shift in this case, a shift. First time to mention it. Left is something specific, a specific side. Based on, and we saw this before, based on the above or above information, because it's been mentioned before, I believe she needs urgent admission. So I don't need and, but you could put. So you have an option there. We'll accept both. So in brackets, both are okay. And urgent admission and management. Please note, penicillin IV has been given as what? As a stat dose. So, how many articles in this letter? Wow, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, up to 15 articles in a letter, everyone. Up to 15 articles. So you're going to be using nouns all the time. Nouns are vital. Every sentence contains a noun, and nearly every sentence contains an article. So it is definitely something you really want to get good at. So now I'm going to throw it out to the audience. I'm just going to do 5 minutes of questions. Does anyone have any questions about articles? This is your chance. An STD, or good question from Eva, an STD or a STD? Ooh, it's good, sexually transmitted disease, STD. It's going to be an, isn't it? An STD, for STD. So use an. Great question, Eva. So I've just gone to the big screen. I'll come back in a minute with that presentation. Any other questions? Put them in. Mike says you found the article flowchart helpful. Excellent, excellent. Yeah, the flowcharts really work. Makes it really clear. Khalid wrote MRI, so it's going to be an MRI, which we did before. Tintu says use of advice and advise. Well, advice is a noun. Think about it like this. Advice, like ice, is a noun. So it's an uncountable noun. But advise, like revise, you're going to revise after this, revise your nouns, is a verb. So it's a verb. So your question, advice, noun, uncountable, advise, verb. Mustafa says presented with cough or presented with a cough. I would say they're both correct. He presented with cough as a symptom, as a collective, but we also presented with a cough because you can have many coughs. So it's a tricky one. Both are acceptable. Michael Labib says fracture femur. Which one is cerebral? A fracture of the femur and tibia? I would say the femur and tibia. That's correct, Michael. Abdel Atif says a left knee pain. Why not the left knee pain? Well, I would say none. He presented with left knee pain for that one. He presented with left knee pain. But if you mention it the second time, you might say the left knee pain had been worsening if you've mentioned it before. So it's all about whether you've mentioned it before. Ramultai says difference between an or a. Watch this video again, Ramultai. We've covered that. But an is for vowels and a for consonants. Boy, Joseph wrote boy, but a boy. So I think I've got all your questions. All right, that's great. I'm sure you have many more. But yes, do your review and hit your grammar books, and you will master the patterns. But this is specifically for health professionals. All right, now I'm going to go out of this page one last time, and I'm just going to wrap this up. So, if you like this sort of stuff and you think it's really helpful for you, well, come and study with OETonline. We've got great study options. We've got virtual classes online for worldwide students. We've got group classes if you're here in Brisbane. We've got some excellent teachers that are dedicated, and they've got your back, everyone. They've got your interest at heart and will help you understand all those questions you may have. We've got courses designed for every profession that sits the exam. So whether you're a doctor, nurse, pharmacist, physio, OT, dentist, radiographer, whatever it is, we do have profession-specific material for your profession. We are a premium preparation provider. That means we've worked with the OET Centre to make sure that all our courses are at the required standard. It's your quality assurance. We've got some great practice material, including new 2.0 material for reading and listening, which is of exam quality. Maybe you've passed the exam and you only need a single skill. We've got options that allow you to select a specific skill, or if you need to study all skills, we can help you with that as well. And guaranteed to improve your language skill and test-taking strategies. And if you can improve that, then you can pass on your next attempt. Check out our website, oetonline.net.au, or send an email to info@oetonline if you need some support. And we've got a special offer for everyone. It's December, it's Christmas time. Anyone enrolls in an all skills course in December, up to December 31, we'll give you a free listening and mock test, listening and reading mock test, which you can do. So that's our special offer for Facebook viewers. And if you do decide to do that and you want to redeem that offer, just send us an email with this code, FBLRMT, after you enroll. Remember, you can't just send the code, you've got to enroll in a course, one of our great courses, to achieve this, to get this offer. Thank you very much. We'll be back next year in the new year with more Prep Hour with Steve. Have a wonderful Christmas, and I wish you good preparation. Bye for now.